How does nasal potential difference diagnose cystic fibrosis? Imagine a tiny electrical test inside your nose that can reveal a lot about your body's salt and water balance. That's what the nasal potential difference test does. It measures how well your cells transport ions, especially chloride and sodium, across their surfaces. This is crucial because cystic fibrosis is a disorder caused by mutations in the gene that makes a protein called the cystic fibrosis transmembrane conductance regulator, or CFTR. This protein acts like a gatekeeper for chloride ions, helping regulate salt and water movement in your lungs, digestive system, and other organs. When the CFTR protein doesn't work properly, it disrupts this balance, leading to thick mucus and other symptoms. The test involves a small device with electrodes that measures electrical voltage across the nasal lining. One electrode touches the inside of the nose, specifically the lower part called the inferior turbinate, while another is placed under the skin on the forearm to serve as a reference point. This setup allows doctors to see the electrical potential difference, which reflects how ions are moving in the nasal tissue. During the test, a series of solutions with different salt contents are perfused into the nose. First, a normal salt solution called Ringer's solution is used to establish a baseline. Then, a medication called amiloride is applied to block sodium channels. In healthy people, this causes a slight decrease in the potential difference, but in cystic fibrosis patients, the drop is much larger because their sodium transport is more dependent on the defective CFTR channels. Next, a chloride-free solution is introduced, followed by medications like isoproterenol that stimulate chloride channels. In healthy individuals, these cause a noticeable increase in the electrical potential, indicating functional CFTR channels. In cystic fibrosis, little to no change occurs because the defective channels cannot respond to stimulation. When interpreting the results, doctors look for three key signs. First, the baseline potential difference tends to be more negative in cystic fibrosis patients, usually around -51 millivolts, compared to about -15 millivolts in healthy people. A reading less than -40 millivolts is considered abnormal. Second, the response to amiloride is more pronounced in cystic fibrosis because the sodium transport is imbalanced. Third, there is little or no response after the chloride-free solution and stimulation, showing the CFTR channels are not functioning properly. This test is highly accurate, with sensitivity over 90% and specificity above 96%. Usually, two abnormal readings on separate days are needed to confirm a diagnosis. It is especially helpful when other tests like sweat chloride tests or genetic analysis give clear results. The nasal potential difference test can also be used in research to see if new treatments are improving ion transport in people with cystic fibrosis. However, the test does have some limitations. Conditions like nasal infections, sinus surgery, or smoking can interfere with the results. Rarer forms of cystic fibrosis might not produce the typical pattern, leading to false negatives. That's why it's important to interpret the results alongside other clinical information and tests. In essence, the nasal potential difference test offers a direct window into how well the defective CFTR protein is functioning in the body. It provides a physiological measure of the cellular problem at the heart of cystic fibrosis. As new therapies aim to improve CFTR function, this test can help monitor how well those treatments are working. For anyone suspected of having cystic fibrosis, it's a valuable tool that complements other diagnostic methods, helping doctors understand the underlying ion transport issues and tailor treatments accordingly. Always remember, if you have concerns or symptoms, consult a healthcare professional for personalized advice and testing.